Victoria, and I'm going to be your provider today. What brings you into the office?
Just for a checkup.
Okay, so today we're going to be doing a complete vascular and peripheral examination on you.
Okay.
Do you have any questions? Okay. I'm going to go ahead and have you lay back, and I will tell you what we're going to be doing step by step as we go. Also, before we get started, I want to make sure that I have your permission to examine you, and I also want you to know that this video will be uploaded on YouTube, and my professor is going to be the only one who sees it. So before going forward, do I have your permission to do this exam?
Sure.
Okay, perfect. So with any kind of examination, the first thing that we're going to do is inspect, and I'm going to work from your neck down. And like I said, I will explain step by step what we're doing.
Okay.
So initially, I'm going to be looking at your neck. What I'm going to be doing is looking at your jugular veins. I want to make sure that there is no kind of abnormalities there, that I don't see any bulging or anything significant that would give me worry, and at this point, I do not. The next thing that we are going to do is we are going to check your jugular venous pressure or your jugular vein pressure. So basically what I'm going to do is I'm going to have you turn your head all the way over here, and I'm going to look in the V between your jugular veins and between your sternal notch here. And I'm going to find the highest point of palpation or pulsation of your carotid artery. And on you, I see it about here. So I'm going to take a perpendicular object. I'm going to bring it midline. I'm going to find your notch here. I'm going to actually just measure this in centimeters from that down to your notch. And on you, I'm seeing about a 2, which is absolutely perfect. Anything less than a 3 is indicative of a very normal person. You don't have any major JVD. Next thing we're going to do is we're going to move on to your carotids. Okay? First thing I'm going to do is I'm going to palpate your carotids. I'm going to feel for any kind of abnormalities, any bruise, any thrills. I'm going to make sure that your carotid pulses are strong. I'm going to only do that on one side at a time, because if I do it on both sides at the same time, I can cut off blood flow to your brain. So over here on the left, I'm looking for pulsation. I don't see any major abnormalities, and I'm palpating with 3 fingers. And you have a very strong carotid pulse, and it is a 3+. Perfect. Over here on the right, the same thing. Perfect. We have a 3+ there as well. And in palpating this area, I don't feel any kind of significant aneurysms or bulging or anything abnormal there. So, and now moving down to your chest. The first thing that we're going to do with any examination, like I said before, is we're going to do a visualization. So I'm looking for any sternal or chest abnormalities. I'm looking for any pericardial bulging or anything like that that I can see externally. And at this point in time, in examining, I don't see anything. So the next thing I'm going to do is I'm going to palpate. There's going to be several different regions that I'm going to palpate, so just bear with me. I'm going to move this up. So the first thing I'm going to do is I'm going to find your clavicle, and I'm going to move down to intercostal spaces, starting on the right side at the vertebral, or not the vertebral, the sternal border. And I'm going to see if I feel any kind of palpations there. This is also over your aortic valve. Moving over to the pulmonic area, which is your second intercostal space on your left sternal border. Again, feeling for any kind of pulsations or anything there. Everything feels good. Moving down to your third intercostal space on your left sternal border. This is your Erb's point. Again, feeling for any kind of palpations or any kind of abnormalities. Everything seems good. I'm going to raise this up just a little bit. I'm going to move down to your fourth intercostal space, and here is over your tricuspid, feeling for anything there. So I'm going to move over to the midclavicular line on the fifth intercostal space, and this is actually the point that is at the apex of the heart, which is where the left ventricle is, and I should actually feel your point of greatest impulse there, and I actually feel palpation there, so that seems completely normal. All right, we're going to be moving on to what we call auscultation. So during auscultation, I am going to listen in all those areas again with both the bell or the diaphragm and the bell. I'm going to go ahead and start with the diaphragm. So So just breathe normal. Everything good, looks good. I'm at the second intercostal space. I'm listening to the aortic valve right now. I hear a very normal opening and closing. Moving over to the left side to the pulmonic valve, I'm gonna listen over that and listen for normal opening and closing. Everything seems normal. All right, I'm gonna move on down here to what we call the Erb's point, which is at the third intercostal space on the left sternal margin or sternal border. Everything is good. We're gonna go ahead and listen to the tricuspid valve, which is at the fourth intercostal space. Listening for any bruise, any murmurs, anything like that that would be an indication of a problem in all these sites, and I don't hear anything. Everything sounds really good. And we're going to go over here to your mitral valve. Again, listening for any abnormalities or any possible murmurs. Everything sounds really good. While I'm auscultating, I'm going to go back up to the carotids and go ahead and auscultate the carotids. I'm going to do that with the bell or the diaphragm, and I'm listening for any bruise. I'm also listening to any kind of sounds that could be a sign of a murmur that is a referred sound that's coming up into the carotids. Listening with the bell. Very good. Let's go to this side. Let's listen for the diaphragm, with the diaphragm. And I don't hear any bruise or referred sounds in your carotids at this time. And with the bell. Perfect. All right, while I have the bell on, I'm going to go ahead and go back to your cardiac sounds, starting here over the aortic valve. Listening for any kind of bruise or indication of a murmur. And I don't hear anything. Listening over the pulmonic valve, listening for normal opening and closing or any indications of a murmur. Very good. Now I'm going to come over here to Erb's point at the third intercostal space, and at this point I'm going to have you take a deep breath. Perfect. Let it out. So at Erb's point, when you're listening with the bell, you want to make sure that you listen for the split of the S2. You shouldn't hear that in a normal person. An indication of a split in the S2 is you're going to hear two separate beats. And one of the reasons that you'll hear this is because in a normal person, the aortic and pulmonic valve should open and close together. But if you have a patient who has respiratory compromise and has increased pressure in their lungs, a lot of times you'll have a delay in the pulmonic valve closing, so you'll hear two separate beats. Down here at the tricuspid valve, again listening with the bell, listening for murmurs or any abnormalities, and I don't hear anything. Lastly, let's go back and listen to the mitral valve, which is the apex of the heart, and listening to the mitral valve to make sure that there's normal opening and closing, and everything seems completely fine there as well. All right, Anne, so we finished up your cardiac assessment. Everything seemed really good. We're going to go ahead and move on to your peripheral vascular assessment. So when we do the peripheral vascular assessment, the first thing I'm going to do is inspect your abdomen. Your aorta runs down the middle of your abdomen. So I'm going to inspect that, I'm going to palpate that, and I'm also going to auscultate that area. I'm going to be checking each one of your extremities, and as we go, I will explain step by step what I'm doing, okay? All right. Go ahead and put your arms down to your side. Okay. So first thing I'm going to do is inspect your abdomen. Your aorta runs through here, so I want to make sure that there's no pulsating masses, that the color and Like sensation is completely normal on your stomach. I want to make sure that everything seems visually normal for the patient. Next thing I'm going to do is I'm going to go ahead and palpate. The reason I'm palpating is because I should be able to feel the border of the aorta on both sides, and I can kind of measure how wide the aorta is that way. On you, you're a bit muscular, so I'm having a hard time actually feeling the borders, but I am visualizing that there is no pulsating masses, and I don't actually really see the pulsation of your aorta when you're laying flat. But again, that's probably due to you being muscular. So now I'm going to go ahead and auscultate. I'm going to do that with both the bell and the diaphragm, keeping in mind that any kind of peripheral vascular sounds is usually heard better with the bell, but I'm going to start with the diaphragm. Again, listening to make sure that there's no bruise. Sounds good. And at this point, the aorta actually bifurcates to the iliacs. So I'm going to listen for those. And then the iliacs actually bifurcate down to your, down to your renal arteries. Back to the aorta. Bifurcation into the iliac. Listening for any kind of bruise. Sounds normal. And then I'm going to go down here to your renal arteries and see if I can hear any kind of abnormal sounds that would indicate any kind of problems. And at this point, I do not hear anything. While I'm here and I'm auscultating, I'm actually going to auscultate your femoral arteries as well. And they sound completely normal. I do not hear any bruise on that side. And I don't hear any abnormalities on this side as well. All right, at this point, we're done with our auscultation. And I'm going to move on to your extremities. So first thing I'm going to do, I'm going to check your bilateral upper extremities. When I'm checking your extremities, I'm going to be looking at color. I want to make sure that there's no cyanosis. I'm going to check your sensation. Do you have normal sensation? Yes. I don't see any shunts. I don't see any varicose veins. I don't see any signs or symptoms of any kind of compromised. Okay, what I'm doing now is checking your cap refill. I'm also checking your fingers for any clubbing, any tar signs, anything like that. Your cap refill should be less than 3 seconds on all of your digits. That seems normal. I'm also looking at hair distribution. If there's abnormal hair distribution, that could be a sign of some abnormal circulation. So checking your pulses, I'm going to start up here and check your brachial pulse, which is completely normal and a 3+. Moving down, I'm going to check your radial pulse, and that is a 3+ as well. Repeating all this on the left side, I am looking at color, I'm looking at sensation. Is your sensation completely normal on this side? Looking at the fingers, making sure that there's no clubbing, no abnormalities, as well as checking cap refill. And hers are less than 3 seconds on each side. Hair distribution seems completely normal. I don't see any shunts, I don't see any varicose veins. Everything looks really good. So I'm going to go ahead and check your brachial pulse here. It's very strong, a 3+. Checking your radial pulse. Perfect, 3+ there as well. All right, I don't see any abnormal signs of peripheral vascular disease on your upper extremities. So Anne, we're going to go ahead and move down to your lower extremities. Starting again, I've already auscultated your femoral arteries, but I'm going to go ahead and feel for them. Very good, 3+ there. And a 3+ there, perfect. I'm gonna check your popliteal arteries or pulses next. I'm gonna have you bend your knee up a little bit. I'm gonna come right in here, kind of deep behind your knee. Moving down, I'm gonna look at your feet, at your dorsalis pedal pulses, and palpate those. Your feet are kind of cold, so those are actually only a 2+ right now. While I'm here, I'm gonna go ahead and check your tibial pulses. And those are a 2+ as well. While I'm down here, I'm gonna go ahead and examine your toes. I'm gonna look for hair distribution on your toes, because a good sign of good vascularization of your lower extremities is if you grow hair on your toes. I'm gonna check your cap refill and all of your toes, and that should be less than 3 seconds as well. While I'm examining your extremities, I'm going to be checking for edema, and currently you have no edema, which is good. I'm going to be looking at hair distribution. I'm going to be checking for varicose veins or any other kind of abnormalities, and at this time I'm not seeing those. I'm going to go ahead and repeat this whole process on your left. We already checked your femoral pulse. I'm going to have you bend up a little bit here. And we're going to check your popliteal pulses, and those are good. Those are a 3+. Again, looking for any kind of abnormalities, looking for any kind of edema, looking at hair distribution. She does not have any kind of varicose veins. Everything's looking really good right now. Moving down, I'm going to go ahead and check her dorsalis pedal pulses. And again, her feet are kind of cold, so I can palpate them and they are a 2+. Coming over here and checking her tibials. Those are a 2+ as well. Checking her cap refill on all of her toes. That should be less than 3 seconds, and they're very brisk. There's nothing wrong with that. I don't see, I've already visualized, I don't see anything abnormal on that. And at this point, I think we have completed our cardiovascular and peripheral vascular exam. Do you have any questions?
No.
Okay, thank you so much, Anne. Take care.
Thank you.